Hi, I'm Dr. Miami, and I'm here at the Acadia Women's Health and Cosmetic Surgery Center with Dr. Owens, an esteemed, renowned OBGYN and cosmetic surgery.
And cosmetic surgery, that's right.
Surgeon. And we were just talking about women's health and rejuvenation of the vaginal and pelvic area, right?
Right, right. So many women come in and they don't know that those things are even offered.
Right.
So I talk more about it, and it's a very sensitive subject. So when we're in conversation, they say, okay, well, I can get all of this fixed, but what about other things, like other things that bother me, not necessarily my husband, but bother me. Mm-hmm. So that's always my main goal, is to say, I want you as confident and as comfortable as you can be, no matter where you are, in public, at your house, with your husband. So that's where we get in that conversation. And so they ask me, so what exactly can I do? And I said, tell me what you're looking for, and then we'll talk about what we can do.
So one of the more common procedures that we see growing in popularity in Miami is labiaplasty. I know you offer that.
Absolutely.
Maybe talk about that a little bit.
So I have a lot of women that come in and say, you know, when I see myself or when I'm in my workout clothes, I don't look like everybody else looks. I would like to be more confident. I always come in with a jacket tied around, and I think it's because my labia are asymmetrical or enlarged. I'm not really sure. So the first thing I tell them is, first of all, you're normal.
Right.
Everything there is normal.
Right.
If you don't like what you see, I understand. Just like women that come in with smaller breasts are normal.
Right.
They may not like it. They want larger breasts, but it's still normal. So once we get past that, and once I get past the fact that they're doing it for them and not for someone else, then we do whatever they need.
Got it.
Yeah.
Now, one operation that you do that I don't do, that I'm actually interested in hearing more about, is the vaginoplasty.
Correct.
That's basically tightening the inside of the vagina.
That's right. And what happens with that is it's all a sexual function thing when it comes to that.
Right.
It is cosmetic, but
it's not just cosmetic. I mean, it's functional.
It's functional, very functional.
Right.
We delivered babies for 15 years.
Right.
And it's the old proverbial when the husband would say, can you put that extra stitch in there?
Right.
That's what it is. So in reality,
but it's more than one stitch.
Absolutely. In reality, they thought that was for them.
Right.
But really, it's for both of us. So over time, after having babies and things just aren't the same anymore, the caliber of the vagina is different. So that's actually what you're doing, is the length of the vagina. You're actually pulling the muscles together and the vaginal tissue to make the width of the vagina on the inside more narrow, so that there's more friction during intercourse and more
sensation,
more enjoyment and more sensation.
Right.
That's correct.
Just curious, what's the healing time on that?
So for a vaginoplasty, the biggest healing time issues are no heavy lifting, make sure you don't get constipated so you don't push down the area that we just fixed.
What about the fun stuff?
Fun stuff? Yes. It's a while. 6 weeks at least.
6 weeks.
So I tell them,
not bad.
don't do anything until you come back and I check everything out and know that it's
if
okay,
it's fun,
and then you can
don't
go.
do it.
That's right.
For
That's
6
right.
weeks.
That's right.
Okay,
that's
fine.
right. And we go over what you can do and what you can't do.
Right.
And when you can do it. Yeah. 6 weeks.
6 weeks.
6
Okay,
weeks.
great.